I'll just get started with a simple greeting and welcome. Welcome to everyone. Welcome to our Thursday morning grand rounds. And I am going to simply announce our upcoming events, and I'm going to be turning the podium over to my good friend and colleague, Claude Mellons. But first, I want to just acknowledge, and actually it's relevant to our June 10th rounds. Many of you know that this week, June 5th, is of the MMW report of the first of 5 cases of pneumocystis carinii pneumonia in young gay men, which of course came to be known as HIV virus and the AIDS epidemic. So next week, so that's June 5th, and you're probably seeing some of this in the press. I've seen some things going on, and it's nice that we're paying attention to this event. On June 10th, we have a special panel that will be moderated by Dr. Ron Baer. On the panel will be Jesse Milan, Wafel Sada, Dana Diamond, and Avram Finkelstein. And this is a commemoration of the June 5th, 1981 MMWR report. And then our final grand rounds of the academic calendar will be on June 24th. We have a very special outside speaker, Raphael Landowitz. And many of you may know he was the lead investigator on the cabotegravir, long-acting cabotegravir for prevention trial. So he'll be talking about injectable PrEP, current knowledge, and outstanding questions. Okay, so now I'd like to turn it over to, as I said, my friend and colleague, Dr. Claude Mellons, the HIV Center co-director, and she will oversee the rest of today's event. Over to you, Claude.
Thank you, Bob. Can everybody, Stephen, can you hear me okay? My internet was going a little bit. Okay, great. So it is, first of all, thank you everybody for being here. It is really with great pleasure that I get to introduce this panel and the moderator, Ezer Kang, and actually it's going to be more of an interview, but I'll talk more about that. It's really quite fitting that this panel is happening at the 40th anniversary of the start of the HIV pandemic, which, as Bob said, we're going to acknowledge next week, because at the same time, you know, that long ago, we were also discovering babies born with HIV. And at the time, I think most of us didn't think they would survive their 5th birthday. But in fact, many of them are not even young adults anymore. They are adults, which is making me feel quite old, as I was commenting before to Victor and Ezer. And it's really to the amazement of many of us that we got to see their grit, their resilience, and just to watch them thrive. And we're going to be, you know, up for a treat today to hear about that. That doesn't mean it's not a struggle. And so we'll hear about that as well. So you know, what I'm going to do is introduce Ezer and then let Ezer introduce Victor and some of what they're going to do today. But I will just start with saying that I had the pleasure of watching a Stigma panel at Howard. Was that a year ago, 6 months ago? I've lost track of time. All right, I'm looking at you, Ezer. And it was really quite extraordinary with young people born with HIV. And so just to get to hear them talk, not just about HIV and stigma, but also their travels and their journey and their wishes and dreams. And I think for those of us in research and clinical work, really getting to hear from people with lived experience is critical for us to be focusing on the most important topics. So I'm feeling quite lucky that Ezer and Victor were willing to do this today. So just a couple of words about Ezer. Don't worry, I'm not going to really embarrass you, Ezer. Ezer, you know, as some of you know, volunteered at the Special Needs Clinic, which was a mental health clinic for women, children, families affected by HIV that I was fortunate enough to start with Jennifer Havens and Sheila Ryan, a social worker, Jenny, a psychiatrist in the early 90s. Susan Trost was a part of it at one point. And Ezer volunteered, I think, in the very beginning before he actually went on to get his doctorate in clinical psych and really become a clinician and researcher and teacher that, with a lot of work behind him that I'm not going to go into. He came back once he got his degree, and he worked with us at the special needs clinic and brought the clinic, actually the model of the clinic, which was at New York Presbyterian Hospital, to Harlem. And he has really stayed in touch with many of the young people who touched all of our lives then. He's currently an associate professor of psychology and interim director of the clinical psychology program at Howard University. He has a lot of publications. He teaches a lot of classes, a lot of people that he mentors. I encourage you to look up his work. And he's been collaborating with my team on CASA, a longitudinal cohort study of young people who've grown up with HIV for a long time. So I will say, Ezer has a lot of expertise. You will see he's a great interviewer, a warm human being. He does tease some of us profusely. So Victor, my fingers are crossed for you. You make it through the next 45 minutes. But he is going to actually introduce Victor. I want to say one other thing. This presentation today is also going to touch on stigma, and stigma has affected the journey of this panel from when it started in DC to coming here, with a number of the adults who were going to be on it at different points deciding to not be on it because of the impact of stigma, not just on themselves, but on their families. Often they didn't really worry so much about themselves, but more about their families. And I will let Ezer and Victor talk a little bit about that, but we're really appreciative, Victor and Ezer, that you're here today with us. And I will turn it over to you, Ezer.
Great, thank you, Claude. It's great to be back here to see everyone. Like Claude mentioned, Howard has been my home for the past 5 years, where I teach in the Department of Psychology. But before arriving at the Mecca, my home was at 135th and Lenox, where I worked with an extraordinary group of people at Harlem Hospital. Quite a few are with us this morning. This was my home for 12 years, where I grew up professionally. The name of our clinic was a family care center, which is a spot-on name because we were in the truest sense of family. We were a ragtag group of providers, such as myself and an unruly bunch of beautiful misfits who learned about life with the virus they were born with, a virus acquired from birth. I remember a kid saying to me once, "Kang, I'm tired of being asked what it's like living with HIV. Hell, I don't know what it's like not living with HIV." Well, many of these children are now adults, and I decided to bring the gang together for a reunion of sorts. But as Claude mentioned, 2 of the invitees called me frantically yesterday afternoon to let me know that they preferred to play it safe and not risk publicly disclosing their HIV status. I get it, and I think we all get it. They consented for me to share their reason. They said, quote, "I feel bad for changing my mind. I don't usually back down from these opportunities. It comes down to not wanting our kids to be affected by the backlash of people knowing our business. And when it comes to my kids, I don't take any chances. I hate feeling this way because we have come far with HIV, but honestly, it still feels like the 80s and the 90s in a lot of ways. Even though it's been 40 years for us, it's not the case for a lot of people," end of quote. 4 decades, 40 years into the epidemic here in New York City at the HIV center of all places, and there are still people who still understandably want to play it safe. But as many of us know, playing it safe has been the modus of operandi for many adults living with perinatally acquired HIV. But there isn't a monolith narrative for playing it safe. Everyone rolls with it in their own way. So I'm going to spend some time this morning chatting with one of my favorite humans who I've had the pleasure and the pain of seeing grow up at the Family Care Center, and in recent years has been an amazing colleague. And since I didn't think this was being recorded, I can also say a friend. We're going to pick up on conversations that we've had over the years, over meals and drinks that I always paid for, about where life has taken him, lessons he has learned the easy and the hard way. On a personal note, Victor has always kept me straight as a provider and a researcher. calling me out when I write esoteric articles that only Claude and Elaine at the HIV Center read. Our hope is that by listening in on our conversation, the amazing providers, the researchers, and people living with the virus on this video call will be reminded to stay on course of what really matters when you live with this godforsaken virus. We will then invite you to join our conversation for the last 30 minutes of our time together by typing in comments and questions into the chat room, which Stephen has kindly agreed to monitor and field. So let's get started. Vic, you good?
I'm good.
All right, Vic. You know, to give us some context before we dive into our conversation, there are many people on this call that obviously don't know you the way I do. Can you tell us a little bit about yourself?
Yeah. Well, good morning, everyone. First and foremost, my name is Victor Reyes. I'm born and raised in New York City, Harlem, New York. I was born in Harlem Hospital. I self-identify as a Latino male. My family was born in the Dominican Republic, but I was born in the US. I was disclosed my status at an early age of 7 years old. It was 4 of us growing up in foster care, but only my younger brother and myself were born positive. I'm currently on a 2-pill once a day regimen. I'm currently taking Otis, Prescovix and Otisfee. If I'm sure I'm butchering that name, but
You are, but that's all. It's good. Your provider's probably on this call anyways. So.
yeah. What are you gonna do? But yeah, that's just a little bit about myself. I currently live in Washington, D.C. I've been in education for a little bit over a decade now, I'd like to say. Sounds a little bit cheesy to say a decade, but I've been working with children for a good amount of time.
Yeah. You know, last night I text you, Vic, during the Knicks game, and then I asked you, wait, how old are you right now? And then you're like saying you're 32. I mean, dang, 32.
Me too.
So I guess my next question is, I mean, you know, as you turn, are you turning 32 or turning 33 this year?
Well, I just turned 32 in April, so stop aging me.
All right, so I still owe you a meal then, huh? Okay, so turning 32 this year, living with HIV for 32 years, what did you not anticipate? Like, what's been the biggest surprise for you as you turn 32 living with HIV? I just never expected to happen if I were to ask you, let's say 10 or 20 or even 30 years ago.
I guess it's a split question, like between what did I not anticipate or what's been like the biggest. I guess seeing commercials for PrEP is really big, you know, going from, you know, a lot of us growing up in the clinic, we would lie to friends or family or people that might have gotten a hint that maybe we were sick some way or they saw pills at our house, and we would tell people we might have had some kind of cancer. We went the more extreme route or either downplayed it or went really extreme. And that's because we were told, you know, not to disclose, not to say anything. You don't know how you're going to be treated out in the real world. And so going from that to now there's commercials talking about PrEP, talking about how to be safe, you know, saying HIV on television. I think that's something I feel like I didn't anticipate. And friends having children who are born HIV negative, is also something that is the biggest thing maybe that I didn't anticipate. Mostly, obviously, because being in the family care center, we were all born HIV positive. So the thought was, well, this is our future. You know, going forward, we will have to, you know, birth or have children that are born positive, and that's just not the case anymore. So I would say, if I had to answer the question, it'd be those two things. Yeah.
I mean, since I don't like to put words in your mouth, but I often do. So I guess what you're saying is that the way the epidemic has evolved, it's actually it's actually improved, or it's actually advanced at a much quicker rate than you anticipated.
I mean, in some ways, so it's a split question for me, at least. Like, there's the positive side to that where I'm like, yeah, the conversation is kind of broadening. But then, you know, we, as the groups that were born positive, the word that was always thrown to us was, oh, but there's going to be a cure. Oh, science is happening. Science is going to, you know, help you guys in the future. And, you know, there was small hope, but at 32 years old now, you know, it's hard to anticipate any kind of cure. You know, it's something that I'm like, there's no way that's going to happen. And you kind of live with that reality.
You know, there's going to be a lot written about HIV in the past 40 years. I mean, even here at the center, they're going to, you know, have events next week. But you've been hearing a lot in the press about, you know, what has unfolded in the past 40 years when it comes to the epidemic. I mean, having lived with HIV for 32 years, I mean, what period in your life did you feel most affected by HIV, in a negative or in a positive way?
I mean, I won't start as a Debbie Downer, so I'll start with some positives. We in Harlem Hospital, at least, we're super lucky. We had a Camp Hope up in Esopus, New York, and we would travel there for 1 week every summer in August. And it's a camp that started off as, let's give these city kids an opportunity to leave the city and live a little bit before they die. And it ended up 20, you know, years of just like having a space where every one of our friends can live openly about their, you know, with their status. We're talking meds, our counselors know our regimen, we're speaking, you know, they're asking us these questions. How are you feeling? How's your health? How's, you know, and to be in this community where they put us on this pedestal and treated us with so much love in a world where, you know, we didn't feel loved at a lot of the times. May it be in foster care, may it be because we hear chatters and friends and families that don't know our status talking about HIV in such a negative manner that, you know, we're just like holding so many things in until we get to this magical place up in Esopus where we just got to be ourselves and feel free from like the stigma of HIV. Where I feel mostly affected, and obviously, you know, a lot of this is, you know, I lost my mom before turning 8 years old. I lost my brother 3 years ago, May 8th. And that's the biggest thing to me, where it's kind of like we've made this advancement and there's going to be so many amazing things written about how far we've come along, but I didn't think I was going to get this emotional this quick. But yeah, you know, someone like my brother who, you know, was born with it as well and was privy to medications and healthcare providers that same as, you know, myself, and we went to our appointments, but you know, health is just so different, and you know, we're still losing people. So I mean, we're so far, but when it hits close to home, it doesn't feel like we're going far at all.
Vic, I don't know if you remember when you, Ricky, Rodney, and I were in DC and we went to have ramen at that ramen joint, and you were talking about just getting tired of hearing just another person at FCC being hospitalized. And, you know, and then you were saying it seems like it was just yesterday. It's the same shit all over again. It just doesn't end. Like it just goes on. It doesn't affect us any differently now as a 26-year-old as it did when we were 16 or when we were 6, right? So sometimes the shit just sticks with you. It doesn't change very much. So that was just like less than 5 years ago when we had that conversation. you know, the same conversations about, how are you doing with your meds? I don't take the meds until 4 days before I see my provider, and my numbers are fine, so why bother take? It's the same conversation, right?
Yep.
But now as adults, right? Yeah, one of the things, maybe you commented about your time at FCC. Oftentimes, providers often say that the quality of care that children and adolescents get at the family care center or at the special needs clinic should be the standard of care that all adolescents and children should receive. They shouldn't be the exception, it should be the norm, but unfortunately it isn't.
Yeah.
I mean, can you talk a little bit more about, thinking back, the impact that it has had
Totally.
on you?
I don't think that a lot of us that were in the family care center would be where we are. At least I know I wouldn't be where I'm at without the family care center. I mean, we again got to go to a place where we didn't feel the stigma of the world. It was just these nurses that eventually became our family. We had our friends that came over, where it didn't become a doctor's visit. It was okay, and early on in the days, we would go once a month to the clinic. So it was every single month we would go and just hang out with our friends while they go and get triage in the back with Jackie, or we're watching The Lion King for the 500th time on VHS, 600 times on VHS, while everyone's playing games, and it didn't feel like anything was wrong. We were just this family environment, and it never felt like we were in a bad situation. And up until the point where we're becoming adults and people are not wanting to transition into the adult clinic because we just don't want to leave what feels like home for us. And to the point where they pushed it back for so many of us, just so we can kind of ease into it instead of kind of getting pushed out. And I mean, I don't know anywhere where they allow 20-something-year-olds this stay in pediatrics just a couple years longer or something, just because of the love that we had for each other and just not wanting to leave something that felt like home, is getting kicked out of your house.
Yeah. I mean, we've often talked a lot about the impact that FCC has had on you, as well as for a lot of your peers. But I'm curious to kind of hear a little bit more about how your time at FCC, the way it's impacted you. How has that impacted you today in 2021 as now an adult post FCC?
Yeah.
I mean, you're an adult living with perinatal HIV. You're an adult born with HIV. Can you talk a little bit about what it's like living with HIV in 2021 now for you?
Yeah. Well, I'm lucky in so many ways. For my wedding, I disclosed my status. We had 150 people at our wedding. I would say 20%, 25% of the people there, which was the immediate family, knew about my status, and the rest didn't. And I'm so lucky, again, Nurse Jackie and Monica and Maxine, all the people at FCC that just drilled facts, drilled us being comfortable with ourselves, drilled, making sure that if this is a conversation we're having with people, how to have it. And, now so many years removed from the family care center, I have friends that my peers come to me for advice on how to disclose. My peers come to me to figure out how to manage that hurdle. And, and that's something that I got to do at my wedding, and disclose my status and try to break down some of those barriers, some of the walls and stigma that carries. But even in 2021, I still it feels different, but it's not in so many. I mean, in the shell of it, it feels like we've, it's so different in 2021 and we've moved a long way. But mean, I have peers that just got nervous and didn't want this to affect their family. And I have friends till this day, they can't say HIV out loud. You know, they'll say, you know, the thing we have, and you know, people can't even say it still. So I mean, we've come a long way, but I mean, medically maybe, or financially in terms of the money that's being put into research, if that. But
do you remember at FCC at the waiting room, all the code word whenever we had guests that were there that we didn't know, the code word for HIV was whether or not you had a house in Virginia.
Yeah.
It basically confused the hell out of people because they were saying, how come there's so many people living in Virginia in this clinic? Right? And then remember that? So to go from that, and I will never forget this, Vic, going from that to your wedding day. I mean, when the vows were given and you talked about your HIV, I was like turning around to make sure, okay, who's going to say anything? No one better say that. People are not saying anything. I was thinking, Vic, what are you thinking?
People were nervous for me.
I was nervous for you. I thought I was having a panic attack.
Yeah.
Okay. But at the same time, you remember our conversation afterwards though, right? I said, Vic, it sounded like you were very intentional about saying that you were born with the virus when you disclosed. Can you talk a little bit more about that decision and, you know, just.
So my brother-in-law officiated our wedding, and he showed me what he was going to say and how we were going to go about it. We had a lot of conversations prior to me, how comfortable I was to disclosing, because I was the one that brought it up. So, you know, it's not like I was coerced into it. But I looked at his speech. I was like, oh, this is perfect. I changed one thing in the whole thing, and it was in the beginning where the sentence was, and Victor having HIV, blah, 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 blah. And I put, well, no, I was born with it. I don't just I was, you know, I don't want this to be mistaken for, unfortunately, where again, you know, the stigma comes even within the small community of the perinatally infected patients, is I don't want people to think that I was being reckless or that I was having unprotected sex, or I don't know. I wanted people to know me and how I got it. And that to me was a huge deal on how I was presenting myself as a HIV positive person. And I mean, till this day, anytime if I'm doing something, if I'm speaking in something that pertains to HIV, I mean, I make it clear that I was born with it. And, you know, that's the only way that I guess I can rationalize kind of speaking out and taking the plunge. Disclosing.
You know, one of the thoughts I had after your wedding when we had this conversation was that as far as we have come along when it comes to stigma, you even mentioned that, you know, it's all over social media right now. People talk about HIV openly. They talk about medications openly, that we have come a long way the past 10, 20, 30, 40 years. However, at the same time, there's still that sliver of discomfort, that sliver of fear that basically led, you know, our friends to not even join the panel today. I mean, you remember we talked to several people to say, hey, listen, would you be open to doing this at Presbyterian, at the HIV Center? And like saying, well, I don't know, I'm not sure. So even though stigma has been reduced, one thing that I'm left with is that even that small sense of discomfort has dramatic effects on a person, right? I mean, it was so important for you to disclose, but to say that you were born with it. That kind of leads to my next question is what remains a challenge about living with HIV, something that you don't expect to change anytime soon? You talked about like having a cure, but what are other things about living with HIV that it's going to be here for a while? Don't expect any changes, and feel free to be a Debbie Downer as you always are, if you want.
You know, I think that in the shell, people can say, yeah, I know how HIV is transmitted, or yeah, we've taken this plunge, we've taken these steps forward. But I think when these conversations are happening, people forget how many people were born with HIV. I think we know people are getting HIV through sex, and we need to make sure that PrEP happens, and we need to make sure that condom use is important, and these conversations are happening, which are so important. But I think that, and I don't know the numbers on how many people that were born with it are alive and how, but we are here, and it feels like between the advancement in medication and HIV kind of coming down in its classification from like this deathly virus to just a mild chronic illness, and which is treatable, and it makes me feel like, wow, like people don't care about how I'm doing anymore. People aren't putting the effort into finding what we were promised at a young age, this cure, and also how we can be a tool in hopefully decreasing the number of new cases, at least in the US alone. I think that people that were born with it, it's almost like a chip on our shoulder where, like you said, I needed to make sure that I said I was born with it before I was able to disclose and able to kind of be an advocate for people around and let people know in this 150-person wedding, hey guys, I was born with it. You guys love me. We're out here and we're just trying to live this normal life. And I think that if there were more tools for people that were born with it to be able to make a bigger impact, to try to create a bigger change, if that space was available, that would be great. But unfortunately, the underlying stigma behind it, the doubt that gets like the fact that I have to say I was born with it is still what's holding the entire, I think, conversation back sometimes, because if I say it, then it's, so how did you get it? Or, oh, this, and it becomes this like very weird kind of limbo between someone wanting to ask how you got it, or can they have this interaction with you safely, even though they know the science, but they still have that small fear. And I think that is something that I don't expect to change.
You know what I mean, as you're talking, it reminds me of something I've never asked you before. So I think, what a better time than now, right? I mean, we're thinking about this, we've been talking about this next stage in life, about potentially being a parent, right? How do you foresee yourself explaining to or disclosing your status to your child in the future? Have you thought about that? Or I mean,
I'm giving it zero thought. It's like the hardest thing that
we know that you named the kid Ezer or Ezerina, but besides that,
oh man.
No.
Our friends that weren't able to do the panel, that's the conversation that they just recently had with their child, and that was the first time I even thought about it, to be honest with you. I was like, oh shoot, I gotta have that conversation. How do you have it? When's the right time? Like, I was told at 7 out of necessity. My mom was dying. We were definitely not going to stay with our like stepfather or whatever at the time. We were definitely going to go back into foster care. My younger brother had it, and I needed to make sure that I can disclose to him what's going on and make sure that I'm on top of him. So it's like, I just knew out of necessity. I feel like a lot of my peers we needed to know out of necessity. Now, to relay that information, not out of necessity, but out of love, or making sure that they're aware. I don't know. That's such a tough question. I hope that we get to continue moving forward where I can continue being comfortable to speak about it. So when that moment happens, it's just kind of glossed over. Like, yeah, we know Victor's positive. Yeah, your dad's fine. Or I don't know. It's hard because again, the stigma behind it. I'm growing up, I know people that just absolutely did not mention it, and we know plenty that because they didn't tell their own family. I know plenty of people that don't tell their own family because they don't want things to get kind of convoluted, and then that stigma again kind of closes a lot of those doors and opportunities.
No, I didn't mean to put you on the spot on it. I know that's something that, I've been kind of wanting to ask you. Just kind of wondered how you and your partner thought about it. One of the things that a word that we've been throwing around a lot is the concept of stigma. I mean, there are many people on this conference call right now who have spent years doing research on it, writing about it, providers who have had to contend with this issue when they work in their clinical work. I noticed that there are a few students at Howard that's on this call right now. You know that I always, before we talk about a concept, it's so important for us to define it. If we don't define it, there's no way for us to really understand it. From your experience, whenever people toss around this word stigma, how do you define it? What does it mean? How would you explain or define stigma to someone who's not living in, who's not in your shoes?
I know I've said in the past, like it's kind of making a person feel bad about either who they are or the person that they are. Also kind of hiding that part of themselves, the part that, maybe makes them proud or something or whatever. But
Wait, say that last part again. What about being proud?
Make them proud, like, because stigma doesn't have to be something that you think it's nasty and then other people think it's nasty, so you hide it. I was like, what if it's, it could be something that you're proud of, but the world thinks of it as just like something negative. I mean, I have to say, growing up, I wasn't proud to like be HIV positive, but knowing so many medical things, being so aware of like immune systems and how medication affects the body, the liver, I felt pride being in school and we had science class, or in high school, and we're talking about all these things, especially when you have the HIV or STD curriculum, which is a 2-day lesson, which is pathetic to say the least. But you have these things, and I'm answering these things, and I feel proud about it, and I know what the hell I'm talking about. But then you answer too much, and then it you raise eyebrows, and then that's the stigma right there. The fact that I can't be proud of the knowledge that I have, that I've gained in all this time, because now I'm going to be put in a bubble as, maybe this person has something that we don't know. But yeah, I mean, again, so I would say just like making a person feel like they need to hide a part of themselves, not taking advantage of opportunities because of the perceived kind of not notion, but just the perceived kind of imagery of them.
Yeah. There's another area of stigma that that a lot of folks have been writing about is how living with HIV brings along stigma that kind of compounds other or adds to other stigma that one experiences. So for example, MSM living with HIV, living in the Deep South, they kind of deal with the stigma of being MSM as well as their HIV status, or someone of color living as a racial minority and being HIV positive. There's always these different types and layers of stigma that kind of add on each other. Has that been your experience at all, or what? Can you talk a little bit about that? I mean, is that something that you have seen happen in your life or around you or in the lives of other people, like peers?
I mean, I've been stigmatized as, I don't know if it's stigmatized as the word, but I've walked with my wife who's white, and her family's white, and we walked into a place together. I mean, example, we went and saw Hamilton like 2 years ago or 3 years ago, and
you did? How come I didn't know about it?
I sent it to you. You didn't get it? Darn. Oh my
I
God.
do this all the time.
Oh, what a blunder. But we went and saw, and I mean, I was dressed to the nine, and I mean, I was looking good that night. And we left the place together where we were staying, and we came back together. I entered the place by myself first, and they were like right behind me, but not too far. I was asked if I needed something or what, like, what's up. I was like, what are you talking about? And
Hmm.
so that's, I mean, that was a very small experience, but it was
Mm.
it was kind of traumatizing and just like in that respect. But in regards to HIV and being, you know, a person of color, me personally, I'm at least, and I've tried to give it some thought when, you know, we were discussing these questions, but
Yeah.
when one of our friends who was supposed to be on the panel and he mentioned kind of his ER situation, it reminded me of my brother and what he was going through. And, you know, he was battling, um, you know, towards the end, and he was in some pain. Not some, he was in pain. And so he was prescribed, you know, a lot of medication for pain. And there were moments that the nurses in the hospitals didn't want to give it to him because they thought that he might have been an addict, or that, you know,
Mm.
there's no way that the doctor prescribed you that. And, you know, based off of what's around us, you know, in Harlem, you know, they have a sign that they're not going to give
Yeah.
like, you know, pain medication in the way in, you know, triage or in the back or whatever the case may be. And it's these unwritten rules or written rules that they're not doing certain things based off of the community that's around. And, you know,
Yeah.
and that's something that I saw a lot with Eric. He had to deal with
Mhm.
either things like that, or, you know, when medications got him sick and, you know, he's throwing up and people are trying to figure out what, you know, I don't know.
Yeah. 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 I mean, one of the things that you've often talked about is one of the things that have really helped kind of reduce or kind of deal with the stigma is being able to rely and being able to depend on your peers. I mean, it's sort of like the feeling that you got when you were at FCC, where it didn't really matter. It just seemed like for a day or for a week or for, you know, during your visits, you just kind of forgot about everything. And that's one of the things that would kind of help you kind of minimize the effects of stigma on your life. Do you find it as an adult now living with HIV that those type of supports are easier or harder to come by? How is it different looking for support as an adult living with HIV right now for you?
Um, Something that obviously, you know, that a lot of my peers and even myself harp on a lot is we had DOT in Harlem. So
Mm.
I'm sure everyone knows what DOT, but it's direct observational therapy. But there was nothing I feel like the group loved more than going to the hospital daily, hanging
Yeah.
out with our friends, shooting the shit and being stupid, buckling down towards the last 10 minutes, taking our meds, and then just kind of going about our day or hanging out afterwards. And there are so many of us that became undetectable because of that. And that was just so huge for a lot of us. And having
Yeah.
that system in place for us was the biggest thing that we could have had at the time. And I mean, it's so unfortunate once, you know, we weren't able to do it anymore, how many people died
Yeah.
after
Yeah.
that ended. And
Mhm.
I think that, and we've spoken how I get into these internal battles where I want to help all of my peers, and I've set up
Yeah.
Zoom calls, and I've set spreadsheets. I love me some spreadsheets here and there, and I've set up spreadsheets based off of people's schedules. And you know, it's hard to track people down or to pick up that phone call. And there's just something so different about being there in person, knowing that people are going through those same struggles as you. And, you know,
Yeah.
Harlem just had a system where we got to kind of build trust within each other to kind of hold each other accountable. And I think that's something that I miss. I mean, thank God my health is great, but you know, not everyone is. And I know that people look for that help. And as adults, like, you know, for perinatally, at least for us being born, like we were giving all these tools and to make sure that we survive, because the thought was we were going to die. And to be given so many tools, like, okay, you guys have places, you have this, and to have it, and then you get pushed into the adult clinic eventually. And it just feels like a lot of those things kind of go away, for better lack of word, or it's not as strong, or there's just such a something different happens, and it feels like it all kind of goes away. And I think that support, you know, is so important.
Yeah. Vic, what do you, I mean, every now and then I would hear comments, or I would hear comments from colleagues that haven't really worked with children or adolescents with HIV. They are adult HIV providers. And the pushback that I often get, and maybe some in the audience have perhaps heard the same thing, is that, you know, y'all in Peds, you spoil them. They're now adults. They're grown-ass adults. You can't expect us to have our nurses stay until 7:30 at night to do DOT to hold their hand. I understand when they were kids or when they were adolescents growing up, but now they are adults. They have to learn to fly on their own. That's the term that I often hear. How would you respond, or how would you respond to comments like that? Like, how would you help them understand what the experience or the impact it has had on you while growing up?
Yeah.
Does that make sense?
No, it makes sense. I would say it's almost like it's all multi-layered. I mean, we are told, you know, as we're doing DLT or as we're waiting for medication, we're also receiving therapy. We're also advising each other on workouts as we're growing up. And so we're all
on what? On workouts?
Like working out, like
really,
like
really
physical fitness.
I get it, but really working out? Okay, sorry, go ahead.
I mean, you know, but I think that, you know, all these things are put into place, and I think that, can you repeat that one more time?
I mean, this whole idea that now that you can't expect those things to continue now that you have become adults, because you should be able to do this on your own now. It's not realistic. It's really the fault of pediatric and adolescent providers for spoiling you guys.
So, okay, so now I got my thoughts together. I would say to that, having HIV already, let alone being born with it, whatever the case may be, you're already walking in this world with such a shell, because it just feels like you can never be yourself. It's this thing that that's kind of looming over you. And for some people, you can kind of put it to the back and then you take your meds in the night or whatever your schedule is. But it almost feels like you can never be yourself. And I think that mental toll that takes on you, I think it's forgotten, because we're expected, oh, you're an adult now, you should be able to just go with the flow. And it's just not. I mean, it's taken me such a long time to find my flow. And because I, you know, carrying that weight through your entire childhood, that you're about to die, or that, you know, you're gonna leave the pediatrics, this like beautiful place with all this warmth and all this family thing, to like, you look on the other side and, you know, it's sad to say, but you see a lot of addicts, or you see just, it sounds bad, unsavory characters, or whatever the case may be, as you're just a young teen, and you're like, you want me to be over there? Already, at least for me, it's like, well, then fuck that. Then once I'm done here, then I'm just gonna do the bare minimum. If it's just take my meds, then I'm done with it, if that. And then as you're carrying the load of being positive, and I think it just all compounds on top of each other, and it creates just like a fog of how to move forward as an adult. And so like, you know, a lot of my friends and I talk about what are the things that some of us, like, you know, in our group chats, what are some of the things that we should do to try to get ourselves out of that fog. And I mean, again, I think between the mental health and physical fitness are like two of the most important things to get anyone out of that fog.
Yeah. You know, I don't, you know, to this day, I mean, someone that we both know at FCC, to this day, he still reminds me how messed up it was, why he was referred to see me by Dr. Abrams.
Mm.
The reason why, and this was the first kid I saw at FCC when I started, and the reason why Dr. Abrams wanted me to meet with this young man was he wasn't expected to live past Christmas. And she wanted me to connect with him so that before the end stages, he would have someone to kind of talk to. And I remember that really struck him. He was like saying, really? Dr. Abrams didn't expect me to live past Christmas, and that's why she wanted you to meet with me. That's messed up, right? So it's sort of like what you were saying, that this cumulative toll that it takes on you as a child, that it doesn't leave you. Even to this day, as an adult, he still remembers that.
Well, and it's also resentment because we're not putting sometimes 100% effort. We didn't put too much effort into things growing up. Fuck it, I'm gonna die soon anyways. And I mean, that is real thought, that real conversations people had and amongst each other, like, fuck that shit. Like, I'm gonna die like in 2 years. You didn't see my numbers? And you know, before you know it, the medication's getting better. Or you know, they're growing up a little bit more, so adherence is a bit better. And before you know it, boom, you're reaching high teens, early 20s, and you're like, fuck, I didn't get myself together. Or you lost how many friends in between that time. I think that's also another mental toll, at least for us, at least, you know, in my small community there in Harlem, we've lost so many friends and stuff. And you know, that sets so many people back, because you're like, fuck, like, I thought we were moving forward. And you know, that makes so many people take those steps backwards, because you're like, well, then there isn't anything good over the rainbow, because look at what we're still experiencing, you know, after all this time.
I mean, we often say that, you know, man, 32 years, you've been living with HIV for 32 years. You don't know life outside of HIV. And all this time, I think I have to remember whenever we talk that 32 years really isn't that long of a time. You can't shake the experiences that y'all have accumulated over childhood and during adolescence. You just can't automatically shake that once you turn 21 and become an adult. That shit follows you, right? And I guess that's what you're saying, is that it's not all of a sudden we transition to adult and all of a sudden it's expected that we become independent overnight. We still carry a lot of weight. We still carry a lot of things that, like, how many people in the adult clinic have actually taken AZT like you guys have? Exactly. Or Kaletra. Remember how we talked about this?
Or Norvir.
I mean,
it was disgusting.
It was nasty, right? And yet that's your first introduction to meds, right? Your first introduction to meds isn't one pill once a day. You know, you weren't introduced to the epidemic when the term undetectable was even on the table. And I think that sometimes as a provider, I mean, for me, myself, I sometimes have to remind myself that you bring with you a lot of experiences that seem like ancient history when it comes to the epidemic, but you still carry it. It still affects you to this. You just can't, again, you can't shake it off overnight.
And you know,
And
I don't know the numbers of how many people were in foster care or had two parent households or stuff, but this also broke families, you know, and this it was a disease that tore communities apart. And I didn't grow up with. I lived with my mom for 1 year before she passed away. We lived with, you know, she gave us up. We lived with our grandma. She took us back for 1 year, in which I believe she knew she was dying. And then she passed away almost exactly a year to the date that she took us. And so many of my peers, like when we were in camp and we, you know, talked about it. So you know that you're positive, and also who do you live with? A lot of us lived with grandparents or in foster care. And so because parents die, and so you know you're also carrying that with you, and it's like it's from no stability, and the only stable thing you have is the family care center, and then they're telling you got to leave also. That shit sucks.
Well, listen, just for the interest of time, I mean, as we're starting to wrap up, maybe Stephen, I know that you're monitoring the chat room for questions and comments. I don't see the chat room. But as you start to gather some of those questions, Vic, I'm wondering whether or not you can kind of close us with some final thoughts on, I mean, we have providers on the call, we have researchers on the call, we have people who are living with the virus on the call. I mean, if there was something that you have experienced that you think would be helpful for other people to understand, like what do you feel people don't get about living with perinatal HIV in 2021 that researchers, providers are somehow just missing the point? What would your advice or what would your insights be in that regard?
So I would say I got a couple things here that stuck in my head, and as I was trying to figure out different answers, but these are the only things that I thought were kind of important. You know, we talk about the mental health, which is incredibly important in all of this, and you know, helped me a lot growing up. Something that's helped me as an adult is my physical health. I think having, if it's riding a bike, taking long walks, whatever the case may be, it allowed me enough time to clear my head or to kind of, you know, get my mind right enough or my body right enough to take my meds, and it didn't feel like I was stuck in like a slog or a fog or something. And I think the physical health doesn't get talked about enough, and how impactful that is into kind of helping the mental health. I feel like they kind of go one in the other together. And I guess having the culture, growing up, we had our small culture of knowing people with HIV around us. And I feel like that's just something that I don't have anymore. I think that even my hospital that I go to, I told you, I asked to see if they had like a group or something, or what's going on here, like who's the care, and they're like, no, we don't really have anything, and it's like, whoa, okay. And it's like, you know, we wait in the waiting room, people are kind of eyeing each other. There's this very weird thing going on that no one kind of wants to acknowledge. It's really weird. And I think that, you know, it's like between breaking down the stigma in the world, then there's the stigma in the waiting room or in the clinic, and no one's, you know, we're used to what happened in FCC, where it was this super welcoming place where someone's waiting for you, and they have things on the table that if you want to like mess around and draw or write or whatever, and you have the TV on, you have friends there, and you're like, oh, what's up? That kind of community. There's groups, you know, that you can sign up for, let's say as an adult, but there isn't anything that makes me feel like, okay, I have my community here, my friends are here, you know, this is the culture of community that I've been missing since I was a young kid. And I think and also just how even if we're all perinatally infected, we all just have different needs. And I think that, you know, you try to lump up a whole group into one and you're like, okay, well, perinatally infected people need this. And it's just not, you know, it's just not the same, because my brother and I were in the same household our whole lives. And I try to get him to take his meds as much as I could. And, you know, he passed away and we both had obviously different needs. And I think figuring out all of our different needs before things get worse is obviously crucial.
Yeah. Well, Vic, you know, you and I will continue this conversation perhaps over a meal that you would buy for a change. But really, I mean, you know, this is, you know, we've done this several times now, and every time we have these conversations, even though there are people, you know, kind of listening in, I've always taken away quite a bit from these conversations. So I'm grateful for that. So thank you. Stephen, I'm going to turn it over to you. Are there, I don't know how you want to do this. Are there questions or comments that audience members want to, you know, ask Victor? If we have time, even if you want to unmute, I would love to, you know, we would love to hear from you. I've seen a lot of familiar faces and a lot of familiar names. So Stephen.
So first, thank you both, you know, so much. This was such a wonderful, and I'm sure for many of us on the call, an illuminating discussion. So thank you, Victor and Ezer. A reminder for everyone joining us this morning, please enter your question in the chat, or if there's a gap in questions, feel free to unmute yourself. But first, I'm going to hand it over to Claude Mellons for her question and comments.
Okay.
Thank you so much to both of you. I hope that actually if you click on chat in your Zoom screen, you can see you're getting a lot of really wonderful, not questions only, but like comments about this. Victor, I told you before the call, I was feeling very old, but really now what I'm feeling like is an incredibly proud mother, which I'm sure a lot of people on this call are, because you know, it's not just that you've survived, you've thrived. And I think that's so important. And I want to thank both you and Ezer for, you know, bringing us into your home, so to speak, and a deeply personal and real and thoughtful conversation that I'm sure is making many of us think about what we do. So that is just my first comment, is a thank you to both of you. This was really powerful. And then my question is actually related to one that Susan put into the chat, but you know, you talked a lot about what the Family Care Center did. And I think places like the Family Care Center and the Special Needs Clinic were really unique, right? Because we were creating a model of mental health care that was different. It brought children and adults together. It was holistic. It was paying attention to the whole person. It was going to people's school performances or funerals, things that didn't happen before. And I think what you've been saying throughout this is you got treated as a whole person, and the whole experience gave you community, but it also let you be a person first, not just a virus, so to speak. And that allowed you to actually focus on your health, because it gave you all of these reasons, I think, and ability to think about the future. And so kudos to any of your providers who are on this call and the providers across the country who, you know, I think took this model. My question for you is back to the adult care system, if you'll bear with me for a moment, which is, you know, there are lots of differences between the peds and the adult program for lots of reasons. But if you were to think a little bit about what those service systems could do, with maybe not all of the resources that the pediatric programs had, or way more numbers of people, but if there were advice that you could give the clinicians, and maybe even advice for what researchers could do to look into that, that would be great. And I can repeat that because I know I threw a lot out.
I know. I don't know. I've only experienced 3 different adult clinics that I've visited. The one where I'm currently at here in DC, at Harlem, and I visited Presbyteria once. I don't know. There's something about, sounds silly, like lighting, kind of, it's different. You'd be surprised how many of these places, hold on, how many of these places have dark lighting in the adult side. And I don't know. Maybe that's just my experience. Having things available for people to do is something that I feel like there's a lot of like magazines and like HIV magazines. No one wants to be reminded over and over again every time why they're there. I don't know. Sometimes I had, at least again, my experience, we always had a welcoming face when we walked into the ped side. Someone always greeted us. And I mean, I'm probably mentioning like the smallest, very like little, like small lame stuff, but those were things that off the top of my head, as you can see, like those are things that made me feel just welcomed every time.
Space matters.
Yeah.
Vic, can I push you a little bit on this? Do you feel that you've ever given adult care a chance?
Yes, because I was part of the men's group with Kyle in Harlem. And when I transferred over, and I try to just be as involved as possible. And it was a different group of men of different ages, and our experience were different. And a lot of the way that they got the virus was different from mine, which, it's great for perspective. But we just had different experience. And the conversations were also different because it revolved around like work and things like that. So yes, I actually did. At least I feel that I gave it a try.
Yeah.
And when I moved here to DC, I really looked for a community. Like I said, I looked for something to hang on to, and I didn't find that.
Susan, I touched on your question. Did you have anything else to comment there?
I mean, Victor Ezer, I just wanted a way to say you are catalyzing and powerful and amazing. And I was just wondering, I asked really what Claude asked, what services could give somebody a chance to be another Victor? And I think you've kind of said some of the things, but one thought I had just now, and I don't know, this is like a fraction of what you're saying functionally, but I'm just thinking of other experiences I've had as a psychologist working with people who've had what are called chronic illnesses, which I guess is kind of what I think of this as. And at this point, for me, but I'm wondering, sometimes they have either leadership training groups, or they have what are called survivor groups, which I think is a bad word, but anyway, for now I'll just say, but the point is to draw people who want to like take where they've been and build on it. So it wouldn't necessarily be everyone in the clinic who's coming from a very different place, but it might be people in the clinic who want to get more community or empowerment from one another. So I just wonder, you may have that in the services where you are.
No, thank you. I mean, I'll look into that. I think for me, at least personally, there's something different about perinatally infected groups where, I can obviously relate to, but also, I don't know, I look at myself as a helper sometimes, especially as an educator. So, with like my peers, like I'm always reaching out and I'm always trying to figure out, hey, how's everyone's bed? Can I do something? Hey, call me. And so that's kind of how I see my role amongst my peers, and hopefully like I can continue doing it in a larger sense.
Susan, I think that you asked such an important question. I mean, I often think about, like, I don't necessarily want to clone you, Victor, by any means, okay? But because, for every, Victor, I mean, we talked about this. I mean, there are a lot of, there are a lot of people that we know at FCC that aren't doing as well,
Yeah.
right? So it's not always like this, it's not always like a thriving narrative.
Yeah.
Like for every, Victor, for every one of your stories, there's other, there are 3 or 4 other stories where it's just pissing us off because things just don't change, right? But it does make me wonder, what is it about certain experiences? I think that, when Victor, Vic, when you and, with a lot of your peers, when they were growing up in such a nurturing environment like the special needs or at FCC, there wasn't drama in their lives that prevented them from experiencing and internalizing being treated, like what Claude was saying, as a whole person. I mean, there wasn't anything extraordinary that happened at FCC or at special needs.
Oh.
They were just treated with dignity. That's it,
Yeah.
right? And I think that, they were somehow growing up, you were in a place where you were able to kind of make that a part of who you are, to really let it sink in that you matter.
Yeah.
And that sticks with you, as you grow up. And I'm not trying to romanticize it, Susan, but I mean, I think there's just something to be said for that. I mean, I think about a lot of, Victor, you and I talked to a lot of other folks that, that aren't doing so well. And in some ways, it doesn't necessarily surprise us all that much, although we desperately want things to be better for them. Because when we were younger, I mean, there was just so many things around them that just vied for their attention that they couldn't fully experience and carry with them the way that they were treated, at Camp Hope or by the nurses or by the pediatricians, right? I don't know. Does that make sense, Vic?
No, it does. I mean, I think that Claude made a great point, as you're touching on also. It's like the whole child approach, the whole person approach. I mentioned not needing so many magazines about HIV positive stuff. Like, I don't need to be I know why I'm here. Like, I want you to just know me, ask me questions. Hey, Vic, want to do some art? Oh, that, like, there's so many ways that you can reach across and still, hopefully get the results you want without beating it into the person that this is why they need it, or this is what you have, so you have to do this. And,
Claude, did you have something to say? Okay. Thank you, Victor and Ezer. We have a question from Ellen. This is to Victor. Can you give us suggestions as to how to better prepare our youth for the emotional aspect of transitioning into adult care?
Again, not everyone deals with these situations same, obviously. I was lucky that, unfortunately, I know Kang, and Kang and I, he was my psychologist, my therapist, and we worked together for a long time, and I got to be comfortable, and that was just, and even if it's just blurting out all these things at him, and then kind of trying to organize my thoughts a bit, and then leaving out of there with at least a clearer sense of myself, and then doing something physical. And I think those things together go hand in hand, and I think making sure that they have good routines in place before going to an adult side. It's easy to assume that they have all these things together because, I've seen them in the clinic and they seem to be doing good. I think making sure that those things are in place, again, physical fitness and the mental health, I think go hand in hand into moving into the adulthood, because it just gives you an outlet for some of the stress that you're going to be experiencing as you move into adulthood. But also establishing really tight-knit group of friends that can hold you accountable and you can hold them accountable and have those things in place. And, you know, we're still a work in progress. At least my group is a work in progress, but we do a pretty good job of trying to hold each other accountable and asking the questions. I think that, you know, you don't get to ask those questions out in public, or you don't have people in your real world ask you these things because no one really knows your status, or no one wants to ask the hard question. And you're amongst your peers. I mean, they're gonna ask, are you taking your pills? What you doing? How many days? You do 2 days, you taking all of them? And, you know, it becomes more natural, it becomes easier, and not seem like a chore as so much like, okay, he's checking in, let me do it, or, you know. And I think having your peers is just going to be crucial going into an adult clinic, because again, it's intimidating because not everyone in the adult side is got the virus the same way you did. And so making sure that you're not overwhelmed by a lot of that experience, and making sure that you can fall back on people that are also transitioning and are going. I think they try to get a group of us always like going into the adult side in Harlem to make sure that we aren't kind of by ourselves throughout the entire process. So I hope that answers the question. That's kind of my 2 cents on that.
I mean, Vic, just to add a little bit to it. I mean, I don't think there's any way that providers or clinicians can socially engineer support for adults, for teens transitioning to adult care. I mean, Vic, the way you've kept in touch, with a lot of the FCC gang is completely initiated by you and also the peers. I mean, it wasn't done, by Dr. Fernandez or, Dr. Fayerse, Dr. Abrams, or Dr. Rotby. It was all you guys. I remember the last time we all got on a Zoom call for Jackie's memorial. It was amazing seeing how you guys were interacting with each other. I mean, even the best group facilitator could not pull that off, right? So sometimes I kind of leave with feeling like the work that, the work that we did at FCC when you guys were in peds, we just have to trust that treatment. Again, I think the best way I can explain it's been kind of internalized and enacted as you become adults, and I just have to trust that happens. But I think the other thing, Ellen, is that I think what you guys are doing at Lurie's in Chicago is amazing. I think the fact that they know that they can continue to contact you. This is my doctor, my pediatrician. I know they can, because I know that you have that kind of relationship with them. That's really, I just think that's so powerful. But sadly, I can't say that every single person, even FCC, has that kind of relationship, with their pediatric providers.
Yeah.
But I think that's key. Right? I don't know. Like, again, I'm putting words in your mouth as usual, but.
I have one more question, but if somebody else does, please ask it, Stephen.
Well, it looks like we have time for one more quick question. So Claude, if you want to go ahead. I think that's...
So Victor, and this is probably, I shouldn't be raising this in the last 5 minutes of this meeting, because I actually think it's really important, but I feel like I need to comment on it. You talked a lot about what many people in academia call the social determinants of health. You talked a lot about the impact on you of where you grew up, of the loss that you had, of foster care, of bias that you experienced, not just because of HIV. You talked about being a person of color, and you talked about all of these experiences that shape who you are. And I'm just, I guess I'm wondering a little bit about any thoughts you have about how that affects how you want you want providers to know, how they might address some of that in their services and clinics, or how our research can look at those issues.
So I hope I answer the question. I would say, because I guess the question that I feel like I've heard is how are these things translating into adulthood? And I would say it's kind of just beginning to realize that regardless of how together people may seem like they have it, I think the baggage itself is just the biggest deterrent to getting people to kind of be adherent to their medication. And so I don't know. I think the mental health aspect is so important, but is how do you kind of, I think I'm going to ramble on that one unless I don't have a clear answer. Unless can you ask that just one more time?
Yeah, no, I'm not sure there is a clear answer. You know, I think we're all struggling with this. And I think your point's really well taken. You had a lot of things happen to you. You know, I think what I guess I'll ask a different question also related to it, but you know, there are people who are interested in post-traumatic growth, how traumatic experiences and difficult experiences actually help you grow and be stronger. But as you're saying, it's a lot of baggage, you know, and so you, Victor, have to figure out how to carry that, how to handle it, how to manage it. And do you have thoughts on that?
So hold on, let me just plug this in. So I would say something that was really important for me and how I handled a lot of it, and I think we might have touched on it a bit, is how close we were with our medical providers. And so like, you know, I had hit some rock bottom points, obviously, as everyone does. And I didn't hesitate to reach out to Jackie, may she rest in peace, who was like a mother to all of us at Harlem. And I mean, without her, a lot of us wouldn't be where we were because she stepped in at a moment's notice, or, you know, or any of the other staff, Kang included. And, you know, we're going to continue to have these baggage, but it was always so reassuring. And again, going from different foster homes and all of these things, our constant was Harlem. It was the staff. Even when people left, like that relationship was already built. And so, like you mentioned earlier, they went to weddings, they came to funerals, they let us know that we were more than just patients. We were more than just, you know, these people that they watched over. Like we felt the love, and at least for me, it made a lot of my experience a little bit easier because I knew worst case scenario, I could always lean back on my medical providers, on these women that I consider my mothers. You know, they helped raise me. And, you know, Kang, I got like any question, like I can text Kang anytime, and, you know,
Not anytime.
Comfortable with it. But I think that's so important to just have that relationship. And, you know, not every medical provider is comfortable kind of going above their role, because that is an extra, that's a lot more work than some people sign up for. But I think that's what makes a successful relationship. I think is what makes a successful adult living with the virus, is having those people that you're like, okay, I'm dealing with this, but I can contact this person and hopefully get a clearer head on my situation today. So I hope that helps.
Yeah, I think you've made really wonderful comments about the importance of support and community and valuing each life.
Yes.
I just wanted to jump in and just thank Claude, because this is really amazing. I just want that to be known. Claude, you're not only a researcher, but you know, a service provider in the research you do. And this is an amazing rounds.
And to touch on at Presbyteria, that was also a huge like spot for me for support also. So thank you so much. I mean, that was where we went after my mom died. That's where I met Ezer and your whole group over there. I mean, Sheila, may she rest in peace, like she was a gem, and our groups that we had. That was just another, I went to I had like 3 groups, and she was one of the people that held those groups at Presbyteria. And I mean, it made the world of a difference and stuff like that. So you guys, I mean, do great work over there.
Yeah, thanks for mentioning that, Susan. I mean, even on the call here, I see, I see Virginia, I see Claude, Trish, Andrea, I see Ellen in Chicago, Kay, we have Ara that's on the phone right now, and of course Elaine and Patty here in Harlem. I mean, everything. The reason why we want to clone, well, why you guys want to clone Victor, not me, why you guys want to clone Victor is because of really the work that you have, the steadfast work that y'all have been doing over the years. So I think it's very appropriate to perhaps end this by saying that it does feel like we're being proud parents. Not that I want to be related to you, Vic, but we are sort of like a proud parent of sorts. So thanks everyone. Thank you, Claude.
So thank you to, I'm going to hold on to that thank you from Ezer because they don't come very often, right? So I want to thank, I really want to also thank Teo and Stephen for helping to make this happen. But really all of the thanks goes to the 2 of you, Victor and Ezer. You've been the inspiration for us and really engaged in bold conversations for us. And I think you have many of us really thinking about how to transform the spaces that we walk in. And so thank you is really all I have to say. And thank you to everybody who joined into this panel. It's the only way we're going to learn, right? And so I really, really appreciate it. And Ezer and Victor, I hope you'll come back for a part 2 at some point.
Great. Thank you, everyone.
Thank you.
Thanks, Claude. Okay, bye.
Bye.